In your kitchen, right now, there is a traitor. It's disguised as a savior. It looks harmless, even celebrated as nature's miracle drug. We trust it, we use it daily with an ironclad belief that it's protecting our hearts. But let me ask you this. Are you certain that the garlic clove you eat each morning is shielding you? Or is it silently waging a war inside your body, neutralizing the very pill your doctor prescribed to save your life? That isn't a rhetorical question. It's a real, living fear. The fear that, despite all our best efforts, despite following all the advice, we are still hurting ourselves. It's that feeling of helplessness when your blood pressure still spikes, even though you take your medication faithfully. It's the confusion when you find yourself bruising more easily for no reason. It's the terror of realizing your efforts to be healthy could be a double-edged sword, pushing you closer to a stroke, a heart attack, and toward becoming a burden to the very people you love. The truth is this: for every 4 seniors admitted to the hospital for unexplained heart complications, one is a victim of this silent war. The war between food and medicine. And today, I am pulling back the curtain on that secret. I will name all 6 deadly garlic mistakes that no one is warning you about. And mistake number 2, it targets the exact medication that tens of millions of people are taking to prevent blood clots, a mistake that can turn a simple cut from shaving or cooking into a bleeding catastrophe that you cannot stop. Now, hearing this, you might be feeling alarmed. Please, don't be. My purpose is not to spread fear, but to give you absolute peace of mind. I won't just point out the traps. I will give you the map to avoid them. At the end of this video, I will reveal Harold's 3T secret: the right time, the right toxicity level, and the safest trade-off. This is the key to unlocking the full healing power of garlic and heart health without sacrificing a single second of your precious life. But first, help me, and help our entire community. Think of the comments section as our confidential health council. Write down the name of one blood pressure or heart medication you're currently taking. Our collective knowledge will become a lighthouse for so many others. Now, take a deep breath. Together, we will step into the first trap, mistake number 6. Mistake number 6 doesn't arrive like a storm. It arrives in silence. The trap isn't sprung immediately. It's set with delicate precision in the morning, right after you take your blood pressure medication, followed by a garlic supplement because you believe you're doing the best thing for your body. And then, it waits. It waits for the moment you stand up from your chair to get a glass of water. It waits for you to get out of bed in the afternoon. And that's when it springs. Have you ever experienced that sensation? That moment when the world suddenly tilts, the floor seems to fall away, and darkness rushes in for a few seconds. That is orthostatic hypotension, a terrifying side effect when you combine the blood pressure-lowering power of garlic with beta blockers like metoprolol, or with diuretic medications. Many people wave it off. Oh, it's just a little dizzy spell. No. For us, at our age, that little dizzy spell is a warning for a catastrophe. A fall is never just a fall. It is a domino chain of misfortune, a fractured hip, months spent immobile in a bed, and then the loss of the most precious thing of all, your independence. The loss of the pride you take in caring for yourself, and becoming a burden to your children. That is my greatest fear. And I believe, it is your fear too. A landmark study published in Hypertension, one of the flagship journals of the American Heart Association, AHA, followed over 1,000 elderly patients for 5 years. The results were chilling. Those who regularly experienced orthostatic hypotension had a 70% higher risk of hip fractures, and a 40% increased risk of death from all causes compared to the control group. 40%. Why is that number so terrifying? Because the mechanism behind it is both simple and cruel. Beta blocker medications work by slowing your heart rate and reducing its force, thereby lowering your blood pressure. Garlic, with its compound allicin, works through a different mechanism. It relaxes the blood vessels. When you combine both, you're attacking your body's blood pressure regulation system from two different fronts. Your autonomic nervous system, which naturally slows with age, cannot react quickly enough to constrict your blood vessels when you stand up. Blood pools in your legs, your brain is momentarily starved of oxygen, and you faint. The case of Mrs. Mary, 72, documented in the archives of the National Institute on Aging, landed her in the hospital after such a fall. Her doctors were puzzled because her metoprolol dosage was perfectly normal. It was only after a thorough investigation of her diet and supplements that they discovered the co-conspirator, 1,000 milligrams garlic capsules she took every morning with her medication. She simply did not know. But today, you will know. And this knowledge will be your strongest shield. Disarming this trap doesn't require a miracle. It requires understanding and discipline. First, and most importantly, separate them. Like two powerful kings ruling one kingdom, they need their territory. The principle recommended by clinical pharmacists at Johns Hopkins Hospital is to create a time gap of at least 4 to 6 hours between taking a beta blocker or diuretic and taking garlic in supplement form. If you take your blood pressure medication in the morning, save your garlic supplement for lunch or dinner. Second, become your scientist. That blood pressure monitor at home is not a decoration. It is your laboratory. Perform the standing test. Lie down flat for 5 minutes, then measure your blood pressure. Write that number down. Carefully stand up, holding on to something sturdy. Stand still for 1 minute, then measure it again. Continue to stand still for another 2 minutes, 3 minutes total, and measure it a final time. If your systolic pressure, the top number, drops by 20 points or more, or your diastolic pressure, the bottom number, drops by 10 points or more at any point after standing, you have a sign of orthostatic hypotension. Take these numbers to your doctor. They are worth 1,000 words. Third, understand the dose. The connection between garlic and heart health is undeniable, but more is not better. Studies cited by the National Center for Complementary and Integrative Health, NCCIH, show that the benefits for blood pressure are achieved at moderate doses, equivalent to 1 to 2 fresh cloves per day. Taking high doses in capsule form is when the risks of interaction increase exponentially. Always start with the lowest dose. This is a lot of information, I know. But it is critically important. If you now understand the importance of spacing out your medications and monitoring your blood pressure at home, please comment with the number 1 below. Just the number 1. It's a signal to me that you've armed yourself with your first shield. We have now disarmed the first paradox, a trap set by good intentions. Now, prepare yourself, because we are moving on to mistake number 5, a silent attack, not on your blood pressure, but on your body's most critical chemical processing plant. Deep inside you, just beneath your right rib cage, lies a biological command center weighing over 1 kilogram. This is your liver. It's not just a filter, it's a sophisticated chemical plant, performing over 500 vital functions, from converting food into energy to neutralizing toxins. And mistake number 5 is not a sudden accident. It is a Mayday signal sent from this very command center. A warning that one of its most critical assembly lines, the one that processes medications, is on the verge of a catastrophic overload. Have you ever felt a persistent, dull ache in your muscles, a profound fatigue that you just can't explain? You might blame it on age or a poor night's sleep. But medicine views it through a different lens. These could be the first symptoms of statin toxicity. This is a cruel paradox. You take a statin, hailed as the golden bullet in the war against high cholesterol and heart disease, but at the same time, you supplement with high-dose garlic, natural miracle, for the same purpose. In theory, it's a powerful alliance. But in terms of biochemistry, it's a recipe for disaster. The mechanism of this sabotage lies within an enzyme system called cytochrome P450, specifically an isoenzyme named CYP3A4. Think of CYP3A4 as a specialist worker, in your liver's factory, tasked with metabolizing and breaking down over 50% of all drugs on the market, including popular statins like atorvastatin, Lipitor, and simvastatin, Zocor. When you take a statin, this CYP3A4 worker processes it. But when you introduce a large dose of garlic, especially the sulfur compounds in concentrated extracts, they demand the attention of the very same CYP3A4 worker. This is called competitive inhibition. The CYP3A4 worker becomes distracted, overwhelmed. It can no longer process statin efficiently. What is the result? The concentration of the statin in your blood, instead of remaining at a safe, therapeutic level, skyrockets to a toxic one. The Journal of Clinical Pharmacology published a meta-analysis showing that co-administration of CYP3A4 inhibitors can increase statin plasma concentrations by anywhere from 200% to 1,500%. What does that number mean for you? It means your risk of suffering from statin side effects increases exponentially. In mild cases, it's muscle pain and weakness. In more severe cases, and this is what terrifies cardiologists, it's rhabdomyolysis. This is a medical emergency where muscle fibers break down en masse, releasing myoglobin into the bloodstream. Myoglobin is a large molecule that clogs the microscopic filtering tubes in your kidneys, leading to acute kidney failure and, if not treated immediately, death. A clinical case report published in the Annals of Internal Medicine detailed a 68-year-old man who was hospitalized with acute renal failure and severe muscle pain. His liver enzyme levels, ALT and AST, were 30 times the normal limit. After ruling out other causes, doctors identified the culprit, the combination of his daily simvastatin dose and a high-dose garlic extract supplement he had bought on his own. He simply thought more was better. This tragic incident was entirely preventable with knowledge. Protecting your liver factory doesn't mean you have to fire the statin or ban the garlic. It means you must become a wise factory manager. First, know your weapon. If you are taking a statin, especially drugs like atorvastatin, Lipitor, or simvastatin, Zocor, be aware that you are using a medication sensitive to the CYP3A4 enzyme. Therefore, prioritize consuming garlic in its most natural form, through your food. 1 to 2 fresh cloves used in daily cooking is perfectly safe and effective, providing the proven benefits of garlic and heart health without creating a dosage shock to your liver. Second, and this is the most important alternative strategy one wants you to remember, seek out aged garlic extract, or AGE. This is not a marketing gimmick. This is a scientific achievement. Age is created through a natural fermentation and aging process that lasts up to 20 months in a controlled environment. This process does something magical. It transforms the unstable and potentially interactive sulfur compounds like allicin into stable, water-based, and incredibly gentle compounds, most notably S-allylcysteine, SAC. SAC is the true star. It is absorbed far more easily by the body and does not compete for the CYP3A4 enzyme like allicin does. Therefore, it does not overload the liver and does not interfere with statin metabolism. The Los Angeles Biomedical Research Institute, LA Biomed, at UCLA has conducted numerous randomized, placebo-controlled clinical trials, with results published in prestigious journals like the Journal of Nutrition. They found that AGE is not only remarkably effective at slowing the progression of coronary artery calcification, a key indicator of heart disease, but also demonstrates a near-perfect safety profile when used alongside cardiovascular medications, including statins. Switching from a common garlic extract to aged garlic extract is like upgrading your factory's processing system from a manual assembly line to a fully automated one, far more efficient and much, much safer. Does this in-depth information about aged garlic extract and the CYP3A4 enzyme mechanism help you understand your body better? If you feel this knowledge is genuinely enlightening and valuable, please comment with the number 2 below. Your number 2 is an affirmation that we are not just passively listening, we are actively learning how to be healthier. We have now reinforced our body's most critical factory. But a more complex battle lies ahead, an overload syndrome that can turn your blood into a raging river. Get ready, because mistake number 4 is waiting. Now, let's mix a cocktail. But this isn't the kind of cocktail you drink at parties. This is the one you mix for yourself every morning, and you call it health. The recipe is simple. First, 181 mg aspirin, recommended by your doctor. Next, an omega-3 fish oil capsule, because the news said it's good for your heart. Add a vitamin E capsule, because you heard it fights oxidation. And finally, our star ingredient, a concentrated garlic capsule to complete the formula. On the surface, this is the cocktail of life. But in terms of hematology, this is the perfect recipe for a silent bleeding disaster. This is mistake number 4, creating an overload syndrome of blood-thinning agents. The pain of this mistake isn't a sharp sting. It's the bruises that appear on your arms and legs when you can't remember bumping into anything. It's a nosebleed that lasts longer than it should. Or more frighteningly, it's the streaks of blood in the toilet bowl that you try to ignore. Did you think that things which are natural and healthy are safe to combine? That is a dangerous misconception. Each ingredient in that cocktail attacks your body's clotting system, but from a different angle. Aspirin, it works by irreversibly inhibiting an enzyme called COX-1, preventing platelets from sticking together. It's like removing all the adhesive between the bricks of a wall. Fish oil, omega-3, the fatty acids EPA and DHA make the membranes of your platelets slicker, making it harder for them to aggregate. It's like coating those bricks with oil. Vitamin E, at high doses, it antagonizes vitamin K, a critical factor for producing clotting proteins in the liver. It's like weakening the very cement used to build the wall. Garlic, the sulfur compounds in garlic, like a gene, also directly inhibit platelet aggregation, similar to aspirin but via a different chemical pathway. A second attack on the same target. When you combine all of them, you aren't just thinning your blood. You are dismantling your body's entire emergency defense system. An analytical study in the journal Blood, the most prestigious publication of the American Society of Hematology, warned that the risk of major bleeding increases significantly in patients who concurrently use multiple drugs and supplements with anticoagulant effects. And the most terrifying risk isn't what you can see. It's the cerebral microbleeds. These are microscopic hemorrhages in the tiny blood vessels of your brain. They don't cause an immediate stroke, but over many years, the accumulation of this damage is directly linked to cognitive decline, vascular dementia, and an increased risk of suffering a major, catastrophic brain hemorrhage. You are trying to protect your heart, but you may be inadvertently harming your brain. So how do you escape this dangerous cocktail? The answer lies in a principle I call the golden rule of simplicity. We've just learned how not to turn our blood into a liability. But the next mistake is even more frightening, because it happens in a setting where you are at your most vulnerable. Join me as we explore mistake number 3, a nightmare that can happen right on the operating table. Before you are wheeled into the operating room, there is a moment of truth. A nurse will hand you a questionnaire, and one of those questions will be, are you taking any herbal remedies or dietary supplements? And this is where mistake number 3 begins. It doesn't start under the bright lights of the OR. It starts with a forgotten confession. With a shake of the head, an answer of nothing important, because you think the few garlic cloves you eat daily to lower your blood pressure have nothing to do with a heart surgery. But you are wrong. Wrong. That forgotten confession can turn a tightly controlled surgical procedure into a life-and-death gamble with your own life. Picture this scene: your cardiovascular surgeon, a leading expert, is performing a coronary artery bypass graft. He needs a clean, bloodless surgical field to sew microscopic stitches onto a vessel the size of a spaghetti noodle. The success of the surgery depends on micrometer-level precision. But the blood just keeps oozing. Not a gushing flow, but a constant, persistent weeping that obscures everything. It's like trying to repair a Swiss watch in a drizzle. Why? Because that uninvited actor we spoke of, garlic, is silently doing its work. The anticoagulant effect of garlic is a complex, two-pronged assault. The journal Anesthesiology, the official publication of the American Society of Anesthesiologists, ASA, published a comprehensive review on this very issue. They identified not just one, but multiple compounds in garlic that work together to sabotage the clotting system. Allicin and other sulfur compounds, they directly inhibit the synthesis of thromboxane A2, a powerful signaling molecule that acts as the superglue to summon platelets to the site of an injury. Without thromboxane A2, platelets become indifferent and cannot form an effective primary plug. A gene. This compound, formed when garlic is crushed, interferes with a receptor on the platelet's surface called glycoprotein IIB/3A. This receptor is the final lock that allows platelets to link together with fibrinogen strands. A gene effectively jams that lock. This effect is not transient. Further research published in the Journal of Cardiovascular Nursing shows that platelet function can be impaired for 7 to 10 days following a single dose of garlic. This means that, physiologically, your body remains in a mild anti-clotting state for many days after you stop eating it. A clinical case analyzed in detail in the journal Neurosurgical Focus described a 58-year-old patient who suffered a spontaneous spinal epidural hematoma, a rare bleeding condition that compresses the spinal cord and can lead to permanent paralysis. The patient had no history of bleeding disorders. An extensive investigation ruled out all other causes until they discovered his health habit, eating 4 to 5 raw garlic cloves daily to manage his cholesterol. Neurosurgeons had to perform an emergency decompression surgery, but the patient was left with permanent, debilitating weakness. And the problem gets even worse when you consider modern cardiac procedures like percutaneous coronary intervention, PCI, also known as stenting. During this procedure, doctors use powerful anticoagulant drugs like heparin. The blood-thinning effects of garlic will synergize with the heparin, creating an unpredictable effect and significantly increasing the risk of bleeding at the catheter insertion site in the groin or wrist. A report from Catheterization and Cardiovascular Interventions has documented cases of large hematomas and pseudoaneurysms requiring surgical repair, all linked to patients' undisclosed use of anticoagulant herbs. You see, this is not a vague risk. This is a real biochemical chain of events, documented and warned against by the world's leading medical organizations. But you do not have to be a victim of this lack of knowledge. You have full control to eliminate this gamble. Adhere to Herald Surgical Safety Protocol, a non-negotiable set of rules. First, observe the 10-day no-fly zone. This is the official recommendation from esteemed bodies like the ASA and the American Society of Plastic Surgeons. Stop consuming all forms of garlic. Fresh garlic in cooking, garlic powder, capsules, oil, for at least 10 days before any scheduled surgery or invasive procedure. Mark it on your calendar. Treat it as a critical part of your surgical prep, just as important as fasting the night before. Second, absolute transparency. When you fill out that medical history form, never dismiss the herbs section. Write it out clearly: regularly consume garlic, stopped X days ago. Tell the nurse, tell the surgeon, and especially, tell the anesthesiologist. The anesthesiologist is responsible for your physiological safety throughout the entire operation. Your information allows them to anticipate and prepare better. They might decide to keep backup blood products closer or to monitor your clotting parameters more frequently during the procedure. Third, communicate in an emergency. If you are faced with an unforeseen surgery, your first words to the emergency team, after describing your main symptom, should be, "I am taking medications A, B, and C, and I ate garlic yesterday." That statement might not change the need for the surgery, but it can change how the medical team prepares for it, and it could save your life. Your responsibility for your safety doesn't end when you surrender your body to the surgeon. It begins long before, with your honesty and understanding. Did this detailed information about the mechanisms of thromboxane A2, a gene, and the 10-day rule surprise you? If you feel this is a profound and essential medical lesson, please help me by commenting with the number 4. Your number 4 tells me that this vital safety message has been heard. We've just learned how to keep the operating room as safe as possible. But the next mistake number 2, is even more insidious. It doesn't need a scalpel to do its damage. It attacks the very foundation of life flowing through your veins. Prepare yourself. Mistake number 2 does not come from ignorance. Ironically, it comes from fanaticism. It comes from the flawed belief that, if 1 is good, then 10 must be 10 times better. It's fueled by the detox and immune-boosting trends that spread online, encouraging you to eat an entire bulb of raw garlic every day. They call it nature's dose. But I call it by another name, the poison of fanaticism. Because when you consume such a massive amount of garlic, you are no longer healing your body. You are inciting a civil war. A brutal war waged within your bloodstream, where your soldiers begin to slaughter each other. Those soldiers are your red blood cells, the tireless oxygen carriers that bring life to every corner of your body. And the pain of this mistake is the feeling of breathlessness after climbing just a few stairs. It's the pale, sallow complexion that suddenly appears on your skin. It's a profound, crushing fatigue that no amount of sleep can cure. These are the symptoms of hemolytic anemia, a condition where your red blood cells are destroyed faster than your bone marrow can produce them. And the mastermind of this civil war is allicin, the miraculous compound in garlic, but at a toxic dose. A groundbreaking study conducted by hematologists at Stanford University and published in the American Journal of Hematology illuminated this frightening mechanism. At extremely high doses, equivalent to eating 15 to 30 raw garlic cloves per day, allicin no longer acts as an antioxidant. It becomes a powerful pro-oxidant. It induces something called oxidative stress on the membrane of the red blood cell. Imagine the delicate cell membrane is like a balloon. Oxidative stress is like relentlessly poking its surface with a needle. Eventually, the balloon will burst. When millions of your red blood cells burst, they release hemoglobin into your plasma. Your blood's hemoglobin level plummets. A case documented in the Stanford study involved a 28-year-old fitness influencer who promoted eating 25 raw cloves daily. After 1 week, she collapsed during a workout. Her hemoglobin had dropped from a normal 14g/dl to a life-threatening 5g/dl. She required 4 units of blood and spent 5 days in intensive care. And here is the direct link to your heart. When your blood no longer has enough red blood cells to carry oxygen, your heart receives a panic signal: we are running out of oxygen. To compensate, it is forced to work harder. It must beat faster and more forcefully, trying to pump that oxygen-poor blood to your organs. If your heart is already weakened by age, coronary artery disease, or high blood pressure, this excessive strain can be the straw that breaks the camel's back. It can induce angina, chest pain, arrhythmias, and in the worst-case scenario, it can trigger a type 2 myocardial infarction, a heart attack caused not by a blockage, but by a severe imbalance between oxygen supply and demand. You are trying to cleanse your body, but you are inadvertently suffocating your own heart. So where is the line between a therapeutic dose and a toxic one? Science has given us a very clear answer. First, respect the maximum safe limit. A meta-analysis of multiple studies, cited by the University of Maryland Medical Center, concluded that the upper safe limit for a healthy adult is 4 fresh cloves of garlic per day. And that is the absolute maximum, provided it is spread out across meals, not consumed all at once. Second, and this is more important, the truly effective therapeutic dose is just 1 to 2 cloves per day. That's right. Numerous studies, including a major meta-analysis of 29 clinical trials published in the Journal of Nutrition, confirmed that just 1 to 2 cloves, providing about 5 to 6 milligrams of allicin per day is sufficient to lower systolic blood pressure by an average of 8.4 millimeters of mercury and significantly reduce LDL bad cholesterol. Anything beyond this dose provides no additional benefits, but only increases the dangers exponentially. That is not wisdom, that is recklessness. Are you surprised to learn that the effective dose of garlic is so small? If this information helps you realize that more is not always better, please comment with the number 5. Your number 5 is a reminder to our entire community of the power of moderation and wisdom. We have just discovered how not to turn an ally into an enemy within our blood. But now, we arrive at the final mistake. Mistake number 1. The most dangerous, the most lethal, because it involves combining garlic with the one medication that so many of us depend on to prevent a stroke. Prepare yourself. When your doctor prescribes an anticoagulant like Warfarin, he is not just giving you a bottle of pills. He is inviting you to sign a blood contract. A life and death pact. On that contract, there are 2 main clauses. Clause 1. The pill promises to regulate your blood with microgram-level precision to prevent a deadly clot from forming in your heart or your brain. Clause 2. You, the patient, promise to adhere to an extremely disciplined lifestyle and not introduce any unpredictable factors that could disrupt that fragile balance. And mistake number 1, the ultimate mistake, occurs when you, with entirely good intentions, breach that contract. You break the pact. Not by skipping your medication, but by adding a clove of garlic. The consequence of breaking this contract is not pain. It is silent. The silence of a spontaneous intracranial hemorrhage that occurs while you are sleeping. A tragedy with no warning, no chance to say goodbye. To understand why it is so lethal, we must discuss the INR, International Normalized Ratio. If you live with Warfarin, the INR is the most important number in your life. It measures your blood's clotting time. Your doctors struggle to keep it within an incredibly narrow window, typically between 2.0 and 3.0 for patients with atrial fibrillation. Below 2.0, your risk of an ischemic stroke skyrockets. But above 4.0, you are walking a tightrope over the abyss of uncontrolled bleeding. And when you add garlic to this equation, you are not just shaking that tightrope. You are cutting it with scissors. The interaction between garlic and warfarin is a pharmacologist's nightmare because it's a coordinated, 2-pronged military campaign against your body's clotting system. Front number 1, the siege at the liver. Warfarin, after entering the body, is metabolized and deactivated primarily by a liver enzyme in the cytochrome P450 system called CYP2C9. Think of CYP2C9 as the only waste processing gate for warfarin. A pharmacokinetic study published in the journal proved definitively that the organosulfur compounds in garlic, especially at high doses, act as potent inhibitors of this CYP2C9 enzyme. It's like placing a massive boulder in front of that waste processing gate. Warfarin cannot be effectively cleared from the body. It accumulates in your blood, day after day. Its concentration skyrockets unpredictably. Your INR can jump from a safe 2.5 to 5.0, 8.0, or even over 10.0 in a matter of days. At that level, your blood loses its normal ability to clot. Your blood vessels, even the smallest ones, become as fragile as wet paper. Front number 2, the direct assault on platelets. Simultaneously, as we learned in mistake number 4, compounds in garlic like agene and allicin directly inhibit platelet aggregation. So you face a dual catastrophe. On one hand, your clotting proteins have been excessively neutralized by the high concentration of warfarin. On the other hand, the first responder soldiers, the platelets, have also had their hands tied. Your entire defense system has collapsed. The American Journal of Hematology published a shocking meta-analysis of 312 major bleeding events related to drug-herb interactions. The findings showed that 71 of those cases were intracranial hemorrhages, with a mortality rate of 34%. These are not statistics. These are preventable tragedies. Dr. Lisa Thompson, a cardiologist at Massachusetts General Hospital, documented the heartbreaking case of a 62-year-old patient whose INR had been stable for years. He started taking garlic supplements on a friend's advice. Within 2 weeks, he was admitted to the hospital in a coma. His INR upon admission was 8.3. He had suffered a massive brain bleed and passed away shortly after. What about the newer drugs like Xarelto or Eliquis, you might ask. They don't require INR monitoring. Are they safer? That is a critically important question, and the answer is even more terrifying. These drugs are also metabolized by the liver, particularly via the CYP3A4 enzyme system, which garlic can also inhibit. The risk of interaction still exists. But because there is no metric like the INR to monitor for an early warning, you remain completely unaware of the silently accumulating danger until the day it's too late. That false sense of security is, in itself, the greatest risk. So what is the solution here? For this ultimate mistake, there is no compromise. There is no gray area. There is only one rule, one red line that you must never, ever cross. If you are placing your life in the hands of any prescription anticoagulant, warfarin, Coumadin, apixaban, Eliquis, rivaroxaban, Xarelto, dabigatran, Pradaxa, then garlic, in medicinal doses, is CONTRNDCATD. What does medicinal dose mean? It means capsules, tablets, extracts, oils, or the habit of deliberately eating multiple raw cloves daily for therapeutic purposes. Consider them poison to you. Eliminate them from your life. What about a little bit of cooking? A very small amount used for flavor infrequently may not cause a major issue. But the key word is consistency. Don't eat a garlic-heavy pasta dish one day and nothing for the next 3. That fluctuation will make your levels dance dangerously. The safest advice from the National Heart, Lung, and Blood Institute, NHLBI, is to keep consumption minimal and constant. Your life depends on that fragile balance. Do not break the contract. This is the most important message in this entire video. It has the power to save a life. And today, I want to give that power to you. I want you to think of one person, a parent, a friend, a neighbor, that you know is taking an anticoagulant. Be their silent guardian. If you promise me that you will share the warning in this segment with at least one person you care about, please comment with the number 6. Your number 6 is not just a number. It is an act of love and responsibility. It is worth more than any thank you. We have walked through the most dangerous territory. But do not leave with fear. Stay. Because now, we will learn how to turn garlic back into a friend, a trusted ally. Let's move on to Harold's 3T secret. We have just walked through a minefield together. I know, right now, you might be looking at that bulb of garlic in your kitchen with an eye of suspicion, perhaps even fear. You might feel the urge to throw it away, to banish it from your life completely. Please, don't. The purpose of this journey was not to create fear, but to build respect. Garlic is not the enemy. It is a force of nature, powerful and wild. And like all powerful forces, we don't need to be afraid of it. We simply need to learn how to tame it. And now, I will give you the reins to do just that. After years of research, reading hundreds of medical papers, and speaking with experts, I have distilled everything into a simple safety protocol, a set of rules so you can harness nearly all the benefits of garlic without gambling with your health. I call it Harold's 3T secret: the right time, the right toxicity level, and the safest trade-off. The first T, time, the golden 10-minute rule. This is the most critical step that 99% of people miss. The miracle compound allicin does not exist in a whole garlic clove. It is only created when 2 different substances, the enzyme alliinase and the compound alliin, come into contact. This happens when you break the garlic structure, when you chop, crush, or slice it. But this process needs time. Research from the Linus Pauling Institute at Oregon State University has shown that after mincing garlic, you must let it rest on the cutting board for exactly 10 minutes before cooking or consuming it. This waiting period allows the enzyme to work at its maximum capacity, increasing the allicin yield by nearly 20 times compared to using it immediately. Just 10 minutes, and you have multiplied its healing power many times over. The second T, toxicity level, the dose of wisdom. As we have learned, more is not better. The most effective and safest therapeutic dose, confirmed by countless studies, is between 1 to 2 fresh cloves of garlic per day. This is the perfect frequency to maintain positive effects on blood pressure and cholesterol without overloading your liver or excessively thinning your blood. Make it a consistent part of your diet, rather than eating a large amount sporadically. And the third T, the most important one for anyone on medication, the trade OFF, a safer alternative. If you are in a high-risk group, taking anticoagulants, statins, or multiple cardiovascular drugs, then the wisest and safest solution is not fresh garlic. As I emphasized earlier, talk to your doctor about aged garlic extract, AGE. With its gentle S-allylcysteine compound and a safety profile proven through hundreds of clinical studies, AGE is how you tame the power of garlic. It provides the core cardiovascular benefits without the unpredictable interactions. It is the choice for peace of mind. And finally, a small cooking tip: high heat destroys allicin. If you cook with garlic, add it in the final stage, cooking over low heat for a short time. A wonderful method is to mix your chopped garlic, after its 10-minute rest, into a little extra virgin olive oil and then drizzle it over your already cooked food. The olive oil not only protects the garlic's compounds but also helps your body absorb them better. You see, garlic is not a simple pill you just swallow. It is a companion that demands understanding and respect. Apply this protocol. Turn knowledge into action. Become the captain of your health ship, rather than a passive passenger drifting on the currents of chance. The power to protect your heart isn't just in your medicine cabinet, it's in your kitchen, and most importantly, it's in your understanding. Our journey today has come to an end. If you feel that this video has given you strength, confidence, and valuable knowledge, please do one last thing for me. Press the like button for this video. And if you wish to continue walking with me on this path of discovering the secrets to living long and living well, please press the subscribe button. But the most important action, as always, is to share. Send this video to those you love. Because knowledge is only truly valuable when it is spread. I'm Harold. Thank you for listening. Stay healthy, and live wisely.